Hello, welcome again to another edition of Matters of the Heart, brought to you by Haverhill Community Television and Pentucket Medical Associates. I'm Seth Bilazarian, a cardiologist with PMA, and I'm with my associate, Dr. Soo Song, a gastroenterologist with PMA, who also specializes in hepatology, the study of liver diseases. And today's topic is hepatitis, but specifically Dr. Song wants to talk about hepatitis C because there's some new recommendations on this particular type of hepatitis that is very interesting, very helpful, and wants to share with our audience. So let me turn it over to you, Dr. Song. Teach us about hepatitis, what these letters mean, A, B, C, and what's new in hepatitis C.
Okay, well, thank you for inviting me. The hepatitis is a virus that affects the liver, that infects the liver and causes inflammation. And inflammation, the hepatitis is very interesting to me because that's also, I trained in liver transplant, and hepatitis or the liver disease is a big interest to me. And I was very surprised when CDC came out with the new guideline. And that's why I chose to talk about this topic because the Center for Disease Control has come out with a new guideline in December that it recommends that everyone in baby boomers era or who are born between 45 and 65 be tested for hepatitis C. Now, there are different types of hepatitis, and just A, B, C, D, E. And these are just letters, and they're just different strains of these viruses. And you may have heard that, or someone just have told me that hepatitis C is a bad type. Well, there is no good type. All hepatitis is bad. But yes, if I had a choice, I would not want hepatitis C. However, the CDC came out with a new guideline because we have better treatment available. Now, hepatitis A and B, we do have vaccination. And I always tell all my patients, if you're traveling abroad or if you're going on a cruise, then get vaccination for hepatitis A and B, because we do have them available. And you can get them at your primary care office or at any pharmacy. Hepatitis B, or I should say hepatitis A, even if you're not traveling abroad, even if you're living in the US, never plan to leave the US or go anywhere outside the country, I still recommend that you get it because there's always an outbreak of hepatitis A somewhere. A couple of years ago, I read a newspaper that said there was a hepatitis A outbreak at some Taco Bell restaurant in Pennsylvania because the worker there didn't wash their hands, and the person had hepatitis A and infected all the customers. I was told that another restaurant in New Hampshire, there was a worker who had hepatitis A, came to work, and infected 1,000 people.
Let me just pause for a moment just to make sure, because I know you're an expert in this, but some people in our audience may have missed what you said. So in terms of hepatitis A, B, C is what you're briefly telling us about. But hepatitis A is the only one that can be obtained by having contaminated food or water.
That's correct.
Whereas the other ones aren't. So you're describing hepatitis A being obtained from, unfortunately, bad health practices at some restaurants.
Yes.
But you can't get the other ones that way, just hepatitis A.
Right.
Okay.
And so hepatitis A, you can get it from the food or at the restaurant. That's why I do recommend all my patients who come to me, I tell them they should get hepatitis A vaccination, even if they don't think they're at risk, because it is it's common. And also the reason is because a lot of people get hepatitis A as a child. And when you get it as a child may develop some flu-like symptoms, feel unwell for a couple of weeks, but they do get better. But if you catch hepatitis as an adult, you can actually die from it. It can cause liver failure. That's why I do recommend people to get this vaccination. Now, hepatitis B is not transmitted through food or other route. It's transmitted through blood, mostly through blood or human body fluid, and all healthcare workers are vaccinated for hepatitis B.
So just to be clear for our audience, so when you say blood contact, so for instance, you and I, we draw blood, we do other kinds of things, so we could be infected just by a needle stick or something like that. So healthcare workers are vaccinated to protect us from a needle stick from hepatitis B in case one of our patients has hepatitis.
That's correct.
We don't get this hepatitis B from contaminated food or water. We get it from a needle stick.
That's correct. Now, other way than, it is transmitted through needle stick. Also, it's transmitted sexually. That's why I recommend people to get it. And there are countries which hepatitis B is very common. And there's always a question whether it's also transmitted through saliva. And I think there is some risk, But I mean, there is a vaccination available, and I tell my patients, why take a chance?
So A and B, we have a vaccine. You recommend it. Let's move on to C, which is your concerning topic.
Right.
No vaccine for this one, though.
As of now, C, there's no vaccine.
Okay.
And however,
I'm sorry, wait a minute, but this one also, just to be clear, is only transmitted either through needle sticks or for sexual contact.
That's correct.
Okay.
So in the U.S., C is most common in the, among A, B, and C is the most common in the U.S., while in the rest of the world, B is more common. B is transmitted usually from mother to their children, while C is most commonly transmitted through IV drug use or sexually, and sometimes we don't know why it happens. And of course, as a healthcare worker, needle stick injury is also a major concern. But IV drug use and sexual transmission is the two major risks for hepatitis C. Third, actually, the less common is dialysis. People who are receiving dialysis are also tested regularly for hepatitis C because up to 12% of people who are on dialysis have hepatitis C. Now, people who have hepatitis C are not just drug users. People who received transfusion before 1992, when we didn't know much about this virus and when the blood supply was not screened, a lot of people who were receiving transfusions for such as hemophiliacs, and a lot of people got hepatitis C. And it's a very unfortunate time in hepatology history. But since 1992, since we have better screening for hepatitis C, the risk of transmission from blood transfusion has declined.
Okay.
Now, so you may wonder, why is CDC now recommending that everyone be tested, just baby boomers? It's because of the time they lived in the 60s and 70s. It's just the lifestyle it was a little different from now. That's why we think that they're at risk. And a lot of times, the people with hepatitis C may not get any symptoms. And they may never know they have hepatitis unless they're tested. There are different indirect tests we can do, but blood test is the best way. And so why we test it? Because if you have hepatitis C and have problems or complications from hepatitis C, it could be serious. And the CDC is also realizing that that we want to prevent these complications because the treatments are better now. Now, so what are the complications that could arise from hepatitis C? Actually, let me take a step back again. So what are the symptoms you can get when you have this infection? A lot of times, people do not have any symptoms. When you actually get infected, you can have a little bit of nausea, flu-like symptoms, but you may not know it. It could be just any kind of viral infection. Up to 10% of people have jaundice, but that's a very small number of people, which is jaundice meaning yellowing of the skin and yellowing of the eyes. They also may develop dark urine, not just dark yellow, but Coke or Pepsi color urine, really dark, or pale stool. But as I said, majority of people don't know they have these symptoms, or they have this infection, or may develop these symptoms, or they may not remember. That's why we recommend people to be tested.
So I think what you just described was someone has been affected and they have an early response or an acute response for hepatitis. So they get that flu-like illness, or they may even go on to get the jaundice, the yellowing of the skin. That's the acute. But you said that there are some people who don't even know about it. So they're infected, but they're chronically infected and they may not know about it.
Right.
Talk about those people.
So when you go to see your primary care doctor, you have blood tests once a year. And one of the blood tests that your primary care doctor does is liver enzymes. And usually people with hepatitis C tend to have normal liver enzymes. However, there are subsets of people who have normal liver enzymes even with hepatitis C for the rest of their life. And that's why we recommend the actual hepatitis, the specific test for hepatitis C. And the reason is because if you don't treat them, it could develop serious problems in the long term. Not everyone gets problems. So people with hepatitis C may never develop any problems, may never know it, but up to 1/4 of people, or 25% of people with hepatitis C, will develop some kind of complications from this virus.
Okay, so tell us about those. So other than, of course, we worry about the liver, Are there other complications, or primarily liver you're talking about now?
Primarily liver, but there are, it can cause other organs damages as well. So it can cause mostly thyroid disease or skin rash, skin lesions, and also kidney problems. Those are the things that we watch for once you have hepatitis C. Now, the hepatitis C, it's not the virus itself that causes the problems in the liver, but it's your immune system, because your immune system is trying to fight off the virus. But the virus is smarter, and it's always evading our immune system, or it's always trying to, it goes away and it comes back more aggressively. So your immune system loses most of the times. And when a liver cell gets infected, your immune system tries to kill these liver cells that are infected, and that causes inflammation of the liver. So inflammation is actually a healing process that your body is your immune system thinks that it's doing a good job by causing these inflammations. However, in the end, it actually causes complications, because with chronic inflammation, it causes fibrosis or the scarring. And that's what causes the problems. And that's what cirrhosis is. And now cirrhosis, again, people with cirrhosis may not know they have cirrhosis, because physically they may not have any symptoms. But when you have complications of cirrhosis, it can be very serious problems. And we talk about people, we even say that people who have cirrhosis, 5-year mortality, or there's a 5-year survival is about 50%, meaning that once you develop cirrhosis, you have about 50% of chance of living in 5 years. And that's why we want to catch hepatitis C early. That's why we recommend that everyone be tested.
So you mentioned a couple things about testing, but can you give us a little more detail about what the testing is? So initial testing is a blood test to see whether you have the hepatitis C in your blood.
Right. And
talk about some other tests that might be done by people like you for these patients.
Now that the CDC has come out and said everyone should be tested for hepatitis C, and we're actually checking for hepatitis C antibodies. Now, hepatitis C antibodies are developed by people in blood in response to hepatitis C. So it's your immune cells developing antibodies to hepatitis C.
Your body's trying to fight against it, so it develops this immune response called an antibody, which is trying to grab onto the virus to get rid of it.
That's right.
So we're measuring that antibody that's trying to grab onto it.
Yes.
Okay.
And unfortunately, the antibodies is not enough to fight off this infection. And usually, when you have these antibodies, that's your immune system immune reaction. However, it's not enough, and because the virus is smarter than us. And so one way to check is whether you have these hepatitis C antibodies. And it is about 98% good, meaning that people who have this infection or who are exposed to it will have these antibodies. Now, the question is whether when you have these antibodies, do you have infection now, or were you ever exposed to it? Because when you're infected with hepatitis C, some people will be lucky enough to fight off the infection. We say about 70%, 50 to 80% will fight off the infection on their own. It's that 30% of people who are not able to fight off the infection that are going to become chronic carriers and end up with problems in the future. So these antibodies we test for will test whether they were either exposed or when they have the infection. So usually when primary care does this test and have positive antibodies, that's when they refer to us. Or primary care doctor may decide to do further testing, and we test, further testing is the PCR. There are other tests called ELISA, but no, it's not. We decided that it is an extra step, extra cost, and so we just decided to move on to PCR. And PCR is basically, we're actually checking the virus level by polymerase chain amplification, which is actually we're checking the virus level.
Okay. So we have a blood test for antibody, then we have a PCR test to actually measure how much virus is in the blood.
Yes.
So that testing is done. Are there any other tests that we should talk about assessing the liver itself?
Assessing the liver itself, so once we know that they have abnormal liver, that there is ultrasound we can do to see, or CAT scan or any kind of imaging to look at the liver. So we are looking indirectly what the liver looks like. As I said, people with hepatitis C, the liver will look normal. Or they may have some fatty liver, which just means fat in the liver. And the other tests, there are other tests such as the fibro test, or there's a fibro test. A FibroSure is a collection of blood tests which checks the scarring of the liver, or FibroScan, which is the ultrasound that checks the elasticity of the liver, which also tells us how much scarring there is. However, ultimately, the gold standard to assess the actual liver damage is the liver biopsy, which in some people we do, some people we don't, because indirectly by looking at blood tests, we can kind of guesstimate whether they have good liver function or not. This hepatitis C will cause inflammation of the liver, and as I said, you have this infection for the rest of your life, but your liver function may remain normal, and you may never develop any problems.
Okay. So after we go through this battery of tests, the antibody test, the viral test, the FibroSure test, in which we try to gauge how bad the liver is, and then a liver biopsy where under a microscope you can actually look at the cells to see how much scarring and how much inflammation there is. We put that all together, and then what are the next steps? What are the options in terms of treatment, and what is treatment involved?
Right. So once we confirm that you have hepatitis C, then we go on to treatment. The treatment involves because now people and the reason why CDC came out and recommended everyone be tested is because younger you are, the better the response. So meaning that people who have hepatitis C, or once we start treatment at earlier age, the response is better. That's why we are recommending everyone be tested now, because we want to start treatment early. The treatment involves interferon, which is an injection medication, which is a protein that kind of boosts up your immune system. So you can think of it as a turbo. You're giving a turbo system to your immune system to fight off the infection. There are two other pills, ribavirin and protease inhibitor. Ribavirin is a nucleoside analog, which again, it inhibits the replication of the virus. And new medication that just came out, that's why this came out with the guideline of treating it. The testing is because of this new medication, which helped us a lot, which its success rate of the treatment, we almost doubled it with this new medication. And it's the third medication that we use now, of course, with new medication, more side effects, but because our success rate has almost doubled, that's, we are recommending everyone be tested. There are different, even among hepatitis C, there are different types of hepatitis C. There's hepatitis.
Before you switch, so just finish on the treatment if you could. You mentioned it's an injection. Can you tell us a little bit about how long people are treated for? What kind of issues? Is it an easy treatment for people to go through? Tell us a little bit more about the treatment itself.
Right, so treatment is not easy, and the treatment will depend on the severity of the liver or how much scarring there is. So if you do have cirrhosis, the treatment is long. It's almost a year or 48 weeks. If you don't have cirrhosis, the treatment will depend on the type of hepatitis C, because there are different genotypes of hepatitis C, just different strains of hepatitis C. In the US, most common is genotype 1, and it is most commonly transmitted through IV drug and IV drug use. And depending on the genotype, so some genotype 1 and 4, we recommend treatment for 48 weeks, or 24 depending on we use this new medication or not. Genotype 2 and 3, we only use the injection and one of the pills, and we only treat for 24 weeks. However, most commonly, people who are using IV drugs, it is genotype 1, therefore it'll be 24 to 48 weeks, depending on how they respond to treatment. Now, once the treatment is started, we do monitor them very carefully to the response and the side effects. And treatment is not easy. I mean, most people complain of severe fatigue, especially after the injection, because basically it's your immune system is boosting up your immune system, so you get all these flu-like symptoms. You get fatigue, maybe you get chills, nausea, but it does get better after about 48 hours. And as you get more injection, symptoms do get better. Some people complain of hair loss, but it's very minimal. And other side effects are anemia. It can lower your blood counts, your red blood cell count, white blood cell count, platelet counts. So that's why before, in the past, we used to give them 6 months supply of medication and then told them to have the injection or to finish the treatment and come back. We never do that anymore because of all these side effects.
Okay. So help us understand who will be the person that's most likely to benefit by this. I mean, we probably would want to use it in most patients, but are there certain groups of people who have hepatitis C that are more likely to have a good response?
I mean, I think there are people, there are certain group of people who will respond better. I mean, there's, as I said, the people who are younger, people who are thin. We found that people who are overweight tend to have less response, and we think that's because of the people who are overweight and tend also to have non-alcoholic fatty liver disease, which is basically it's another liver disease on top of hepatitis C. And there are genders involved, and there are some ethnicities respond better.
What's the gender? Which gender responds more commonly?
I think it was I think it was the male who respond better.
Okay. Okay. Great.
And however, I mean, to me, whenever someone comes to me with hepatitis C and is willing to start treatment, unless they have the contraindication to treatment, I do treat everyone.
Okay. So just to understand some of the highlights of, I think what you said is that hepatitis C has had a recent change from a national recommendation from our Centers for Disease Control because of new therapies, and these new therapies have led the recommendation that everyone be tested to see if they have it, even if they have no symptoms. A completely well person is now recommended to be tested for this.
Yes, everyone who were born between 1945 and 1965.
1945 to 1965. If you're born after 1965, you're not recommended to be tested.
There's no recommendation to be tested if you're born after that. However, if your doctor should be doing liver enzyme tests once a year, and anytime there's an increased liver enzymes, it is done. I mean, as I said, the hepatitis C is most commonly transmitted through IV drug use, or it's also sexually transmitted. However, up to 30% of people with IC, or in general, the studies have shown that we cannot find the specific reason. And that's why if you have abnormal liver enzymes, your doctor will test you for hepatitis C.
Okay. So once the testing goes on, you gave us a series of tests, a antibody test, a direct virus test called PCR. Mm-hmm. You said that there's a FibroSure test that's sort of a group of tests that can help evaluate the severity. You mentioned imaging, ultrasound, or CAT scan to look at the liver, and maybe even a liver biopsy are the tests that could be involved to assess how much hepatitis there is and how bad the liver has been affected.
Yes.
And then you mentioned that the next step is these 3 drugs that could be for up to 48 months.
48 weeks.
48 weeks, excuse me. And that during this time, people often have a tough time with it. Is it weekly, the testing or the therapy? How often is the testing or the therapy? The therapy that patients get, do they come weekly for
the therapy there is done at home. We give them we prescribe month supply.
Okay.
And then they inject, it's a subcutaneous injection just under the skin. They do that once a week.
Okay.
And they take pills every day.
Okay.
One pill is twice a day, and second one is 3 times a day.
Okay.
And they have to come back for the blood test every 2 weeks, but they are given medications by themselves at home. Now, I didn't mention about the complications of, I mentioned cirrhosis briefly.
Let me just say, so cirrhosis is something that people hear about, but just from a simple standpoint, I think of cirrhosis as sort of like a scarring where the liver, instead of being able to have the healthy cells that filter out things that the liver normally does and makes important chemicals for our body, it just turns to a scar. Is that a simple explanation of cirrhosis?
Yes, because of the inflammation causes scar. It's like, if you have a surgery or if you have a cut, you have severe, the cut becomes red, painful, and hot. That's what inflammation is. And when you have inflammation in the liver, you don't just get one line or one scar, you get millions and billions of scars. Now, when you have cirrhosis, you can have complications from two reasons. One is that because of scarring, the architecture of the liver, there are blood vessels in the liver, lymphatic systems, these architectures are destroyed, they are distorted. Therefore, you get backup of the blood flow. That's why you can get complication of what's called ascites, or fluid in the belly, or esophageal varices, which is basically dilated veins in the esophagus, which can rupture and bleed, and also swelling of the legs, edema. That's from the distortion of the architecture. You can also have complications of synthetic function. Because liver cells are damaged, your liver does not function as well. So and liver's job is basically to metabolize toxins. And if liver doesn't function well, you have buildup of these toxins, which can cause confusion and other problems. And once you have cirrhosis, there is no medication we can give to make it better. The only treatment available is liver transplantation. And As I mentioned, we do recommend early screening and early testing and early treatment because once you have cirrhosis and if you need liver transplantation, there is not enough liver for everyone. I mean, liver does not grow on a tree and we cannot create liver in a lab. So someone has to die and donate liver for a person with liver disease to receive a new liver. Therefore, it's scarce. People die while waiting for liver transplantation, and that's why I think that everyone should, between 1945 and 60, who are born between 45 and 65, should be tested. Then we know that we can prevent this cirrhosis.
I think that's an important point you made at the end, because I didn't want to leave people with the message that, this treatment sounds like it could be very difficult over 48 weeks. Some issues with nausea and fatigue and hair loss, but that the alternative is maybe not being able to get a liver and dying waiting for a liver transplant, or just going through a liver transplant is not that easy. So clearly one is better than the other, and early treatment is clearly preferred.
Yes.
And I think you told me also that early treatment in younger patients is much more likely to be successful as well.
Correct.
Great. Wow, what a fantastic and thorough review of the topic of hepatitis. Dr. Song, specialist in hepatology and gastroenterology, joined me today and helped us review and understand hepatitis A, B, and C, but focused primarily on hepatitis C. He taught us today that it's transmitted from either intravenous drug use or sexual contact or blood from the past. And he said the CDC has now recommended that everyone who's a baby boomer, 1945 to 1965, should have a blood test to test for hepatitis C, because new therapies have helped reduce the chance that the liver will fail or go into what's called cirrhosis, in which the only option is to either have a liver transplant or ultimately die. So those are important concepts he taught us, and he taught us a bunch of things about testing, including the blood tests that are used, as well as imaging that can help make an earlier identification, and the earlier identification leads to earlier treatment and leads to greater success. So a really fantastic review for us on a topic that I am not an expert on, but certainly he is, and I certainly appreciate his review. So that's it for this episode of our Matters of the Heart. I'm Seth Bilazarian from Pentucket Medical Associates. Thanks for joining us here on Haverhill Community Television, and see you next time for another episode. Thank you and good night.